Hi everyone, this is Kate Warnock coming to you from the GuideWell UST Global Innovation Center here in Medical City. I'm delighted to bring our new guest to the Insights Lounge, Richard Sweat. Richard, welcome.
Thank you very much, Kate.
So Richard, you are the president and CEO of Decimal LLC. So I thought we could begin perhaps with a description of what your company is and what the mission is behind it.
Sure. My company manufactures radiation therapy devices for cancer patients. These devices help shape the radiation around the tumor and spare the adjacent tissues from the harmful radiation. It's an interesting internet-based business where we never know what we're going to do every day till today happens because they upload their files to our website. We make it that day, ship it out that night.
How about it? So you were telling me that your website actually has a counter on it. Tell us what that counter is tracking.
Well, there's an interesting book out, and it's by Simon Sinek about It Starts With Why. And our why is it's all about cancer patients, and it's on improving the lives of cancer patients. So we count each patient that we make a device for, and I checked it earlier today, and we're at 54,350 roughly.
You know, so it's such an extraordinary thing and so commendable because so much of the conversation that we've been having here on day one of our Greater Than Cancer immersion event is talking about how we really have to focus on the patient experience and the human side of this whole journey. You know, it's so easy to get caught up in the technology and look at the technology that you're delivering. It's your entire business, but you know, here you are, a technology, manufacturing, web-based company that keeps tracker, and I think that must really drive a lot of your decisions and what you do, doesn't it?
There's no doubt. My first job out of high school was working in a radiation oncology clinic here in Orlando. I didn't even know what radiation oncology was. You know, I was going to the local community college, and I've never forgotten the faces and the patients from way back when, and it's just been part of the business. This past February marked 30 years, and so we're very proud to be in business and helping a lot of cancer patients.
And no doubt you've seen a transformation within the industry in those 30 years from where you started to where we are today, and hopefully even looking forward. So, you know, I have to ask you, given your history and your experience in this field, from your perspective, what area of the cancer experience is most ripe for disruption?
That's a great question. In my opinion, I believe it is about performance. I think a lot of times what I've seen from around the world in radiation therapy, that just because you open up a cancer center, it's like, okay, here's your participation trophy, essentially, you know, and there's been a reluctance to move to pay-for-performance and standardization and credentialing, and you know, we need to really understand who we're going to be treated by. Here in Orlando, we're blessed with Orlando Health, with Florida Hospital. Down the road in Tampa, we have Moffitt. Right. We have extremely great cancer care in Central Florida, but I've seen parts of the country that don't, and part of the unfairness is some of those smaller town facilities are getting paid the same thing as if they were at Moffitt or at UF Health. And you know, these kinds of places, they spend a great deal of money on research, on technology, on staff, and that's a bit of an inequity in cancer care, I think.
You know, it's remarkable. You mirror a comment that we had Dr. Rich Wender, who's the Chief Cancer Control Officer for the American Cancer Society. It's precisely the area that he honed in on when he said if there was one thing he could pick to fix, it's equity and access and letting everyone have the ability to have the best possible care. So you were very like-minded in that. So how about that?
Thank you.
One more question for you. So
sure.
From our first day, you know, we've had so many different conversations. We've had really, really moving panels and breakouts. Were there any surprises for you from day one?
From the device side of the business, it's very different from the payer side. And so a lot of the discussions that I had in my breakout sessions about payer environment and some of the issues that they have to deal with, and it was just enlightening. It was very educational, informative, to try to look at it from another's perspective. But that was probably some of the most remarkable. I think the stories this morning, they were powerful.
Yes.
And again, it's all about the patient. And
Absolutely.
so got great value out of that too.
Well, Richard Sweat, thank you so much for sharing your time with us and your expertise and all that you do in your side of this cancer journey. Commendable, really, truly. So,
Well, thank you very much. It's been a pleasure, Kate.
All
Thank
right,
you.
well, my pleasure. My name is Kate Warnock. Thank you so much for watching.